Pathogenesis of AIDS, acquired immunodeficiency syndrome. Most of you know that this AIDS has been caused by a virus called HIV, human immunodeficiency virus. This HIV virus have an outer core and an inner core. The outer core contains glycoproteins and the inner core contains the genetic part of a virus, that is RNA, and the enzyme called reverse transcriptase. Now we can move on to the pathogenesis of HIV, that is what happens if an HIV particle enters into our body. Firstly, this HIV particles, it attaches to the receptors on the helper T4 lymphocyte cells. Then what happens is, this HIV particle, as we already said, the inner core contains the RNA and the reverse transcriptase enzyme. These two things, it enters into the helper T4 cell. Then the conversion of this viral RNA into DNA, that is a process called a transcription, takes place there. And this process can be blocked by a drug which has been termed as AZT, that is azidothymidine. So if you are using this drug, the process called a transcription doesn't occur there, which means we can use this drug as an antiretroviral medication. If you are not using this drug, this RNA is converting into DNA, then this viral DNA, it joins with the helper T4 cells DNA. Just think then what happens if replication takes place. Then if replication takes place, this along with the helper T4 cells DNA, HIV cells DNA is also replicating, that is viral components, new viral components is producing. So what happens? New virus particles assembled there. Then as time passes, this infected T4 cells, they shed a lot of these kinds of HIV particles. They goes and invade into other helper T4 cells, which means they infect other helper T4 cells and lymphoid tissue. And this infected helper T4 cells, it gets destroyed as time going. So that's the main idea about the pathogenesis. And when we say about the infection of this HIV, it mainly contains three phases. The phase 1, that is the initial infection, it usually for about 3 to 6 weeks. It's mild, non-specific and have only flu-like symptoms. And when we say about the second phase, that is the phase 2, it is called as latent phase. And it may last for years. In some patients it may be 5 years, in some patients it may be 10 years. It may vary, it depends on patient. So in this phase, that is in latent phase, the patient may be asymptomatic or the patient may have lymphadenopathy. So patient may be asymptomatic or lymphadenopathy may be present. The main thing what happens in this phase is the count of helper T4 cell is decreasing. That decreased helper T4 cell count, which result in weakened immune response. So as time passes, patient is moving into a phase of active infection in this phase, that is in latent phase. So what happens if a patient moves into active infection, that is a phase 3, acute AIDS immunodeficiency. In this phase, the patient will have only very low cell count, and this phase, it has been considered as a multiple severe opportunistic infections. So what is this opportunistic infections? These are infections that occur frequently in case of weak immune system. In case of weak immune system. So it may be protozoal or helminthic infections like cryptosporidiosis. It may be fungal infections like cryptococcosis. It may be bacterial infection. It may be viral infection which can be caused by the viruses like herpes simplex virus, cytomegalovirus. It may be cancers. Different type of cancers are the like Kaposi-sarcoma, lymphoma. So these are some ideas about the opportunistic infections. So that's about the pathogenesis of AIDS. Hope you guys understood.